Hello everyone, my name is David Wilson, and this is my science highlight presentation on nutrition and chronic liver disease, a consensus statement of the Indian National Association for Study of the Liver. We'll be going over the background, design, methods, results and analysis, conclusion, references, and I'll have my questions for the discussion at the end of the presentation. Introduction to chronic liver disease. The objective of the study, the primary aim was to provide evidence-based recommendations for nutritional screening, assessment, and management in patients with chronic liver disease. Chronic liver disease is a significant global health issue affecting millions of people worldwide. It encompasses a range of liver conditions, including cirrhosis and liver cancer, which can lead to severe health complications. Some of the importance of nutrition in CLD, malnutrition and sarcopenia, also known as muscle loss, are common in patients with chronic liver disease. These nutritional deficiencies are associated with poor clinical outcomes, including increased risk of decompensation, infections, and mortality, which is why there was a need for consensus guidelines. Despite the critical role of nutrition in managing CLD, there is a lack of standardized guidelines for nutritional assessment and intervention. The Indian National Association for Study of the Liver, INASL, recognized the need to develop comprehensive guidelines to improve patient care. The guidelines are intended to be applicable to both adult and pediatric populations, and the detailed findings of the consensus statement on nutrition and chronic liver disease by the INASL covered several key areas. One is the prevalence and impact of malnutrition. Malnutrition and sarcopenia are highly prevalent in patients with chronic liver disease, affecting up to 50 to 90% of patients depending on the stage of liver disease. These conditions are linked to increased risk of complications such as infections, hepatic encephalopathy, and higher mortality rates. The second key area was nutritional assessment. The study recommends using tools like the Subjective Global Assessment (SGA) and the Royal Free Hospital Nutritional Prioritizing Tool (RFH-NPT) for initial nutritional screening. Techniques such as bioimpedance analysis and dual energy X-ray absorptiometry and computed tomography scans are suggested for assessing muscle loss and fat stores. The third key area was nutritional requirements. Patients with CLD often have increased energy requirements. The consensus recommends an intake of 30 to 35 kcals per kilogram per day. Adequate protein intake is crucial to prevent muscle wasting. The guidelines suggest 1.2 to 1.5 grams per kilogram per day of protein. Special attention to micronutrient deficiencies, particularly vitamins A, D, E, K, and zinc, is emphasized. Fourth key focus was on nutritional interventions, tailoring dietary plans to meet individual needs, including small frequent meals and late evening snacks to prevent feeling-induced catabolism. Use of supplements, especially those rich in branched-chain amino acids, is recommended for patients unable to meet their nutritional needs through diet alone. For patients with severe malnutrition or those unable to consume adequate nutrition orally, enteral or parenteral nutrition may be necessary. And the fifth key area of focus was on special populations. Specific guidelines for children with CLD focusing on growth and development are included. Recommendations for managing nutrition in patients with conditions like non-alcoholic fatty liver disease, INAFLD, and glycogen storage diseases. These findings highlight the importance of a comprehensive and individualized approach to nutrition and managing CLD to improve patient outcomes. We're going to now be going over the study designs and methods. The type of study was a consensus statement developed by the Indian National Association for Study of the Liver. Their objective was to provide evidence-based guidelines for nutritional management in patients with CLD. The study involved a thorough review of existing literature on nutrition and chronic liver disease. The sources were peer-reviewed journals, clinical trials, and existing guidelines that were analyzed to gather relevant data. This then went through a expert panel. The consensus was developed by a panel of experts in hepatology, nutrition, and related fields. The panel conducted multiple rounds of discussions and meetings to reach a consensus on various aspects of nutritional management. Uh, Data was then collected from studies involving both adult and pediatric patients with CLD. Various tools and methods were used to assess nutritional status, including subjective global assessment, Royal Free Hospital nutritional prioritizing tool, the RFHNPT, bioimpedance analysis, dual energy X-ray absorptiometry, computed tomography, which then they were able to focus on nutritional interventions based on the collected data. Specific dietary recommendations were formulated. Guidelines for the use of oral nutritional supplements, enteral and parenteral nutrition were established. Recommendations were tailored for special populations, including children and patients with metabolic liver diseases. The consensus development, initial drafts of the guidelines were created based on the literature review and expert input. The drafts underwent several rounds of review and revision by the expert panel, and the final consensus statement was approved by all panel members and published in the Journal of Clinical and Experimental Hepatology. This figure is the Royal Free Hospital Nutritional Prioritizing Tool for determining nutritional risk in cirrhosis. They have 3 steps that you can go through. I'll let you go over this as we move on to the results and analysis. We're going to go over some results now. There was a prevalence of malnutrition and sarcopenia. The study found that malnutrition and sarcopenia are highly prevalent in patients with CLD, affecting 50 to 90% of patients, depending on the disease stage. These conditions are associated with increased risk of complications such as infections and hepatic encephalopathy and higher mortality rates. Nutritional assessment findings were the use of SGA and RFH-NPD proved effective in identifying malnutrition. Techniques like Bioimpedance analysis, DEXA, and CT scans were useful in assessing muscle mass and fat stores. The results for the nutritional requirements were patients with CLD have increased energy requirements with recommended intake of 30 to 35 kcals per kilogram per day, as well as adequate protein intake is crucial with recommendations of 1.2 to 1.5 grams per kilogram per day to prevent muscle wasting. They want to focus on common deficiencies for micronutrients that include vitamins A, D, E, K, and zinc, which need to be addressed in the nutritional plans. Some of the nutritional interventions would be tailoring dietary plans, including small, frequent meals and late evening snacks are recommended to prevent fasting-induced catabolism. Supplements, especially those rich in branched-chain amino acids, are recommended for patients unable to meet their nutritional needs through diet alone. For patients with severe malnutrition or those unable to consume adequate nutrition orally, enteral or parenteral nutrition was necessary. For special populations. Specific guidelines were provided for children with CLD, focusing on growth and development. And patients with metabolic diseases, it's recommended that they tailor their nutrition management. Recommendations were tailored for managing nutrition in patients with conditions in non-alcoholic fatty liver disease and glycogen storage diseases. Some of our outcomes of the analysis are the implementation of the nutritional guidelines led to improved clinical outcomes, including reduced rates of complications and better overall survival. Patients adhering to the nutritional recommendations reported better quality of life and physical findings. A summary of the key findings are malnutrition and sarcopenia are common in patients with CLD and significantly impact clinical outcomes. By utilizing tools like the SGA and body composition analysis methods are crucial for accurate nutritional assessment. Personalized dietary plans, including adequate energy and protein intake and the use of supplements, are essential for managing malnutrition in CLD. The importance of the guidelines are the consensus provides a standardized approach to nutritional management in CLD, ensuring consistency in patient care. Adhering to these guidelines can lead to better clinical outcomes, including reduced complications and improved survival rates. Proper nutritional management can significantly enhance the quality of life for patients in CLD, and continued research is needed to further refine nutritional guidelines and address emerging challenges in the management of CLD. Efforts should be made to implement these guidelines in clinical practice and educate healthcare providers on their importance. My final thoughts are the development of these guidelines was a collaborative effort by experts in hepatology and nutrition, reflecting a comprehensive and multidisciplinary approach. The consensus underscores the commitment to improving patient care and outcomes through evidence-based nutritional management. Thank you. Please continue to the end of the presentation so you can answer the questions in discussion.